Hi, my name's Mary and I'm a registered nurse, and I want to welcome you to my corner of the internet. The purpose of this series of videos, this Facebook page or these YouTube videos, depending on where you found them, is to provide you with a little bit of sanctuary from the emotional stress and strains of the COVID pandemic. I was going to create a tapping resource for nurses to help bring tapping to the bedside, to help nurses to learn how to use this very gentle and very simple technique. But I think that my priority right now needs to be for nurses. We are out there caring for people. We are contributing to the well-being of our families in ways that we never had to before. Honestly, everybody's home all the time. Children need help with learning. Spouses need support. The house needs to be cleaned, and you're still going to work. There are things going on at work that we have never had to deal with on this level. Our patients are very, very sick. Our patients are very, very contagious. And in addition to the fear that we might get sick ourselves, we're concerned about taking it home to our families. We don't have the PPE that we need. We hear daily about rising numbers. And we hear a lot of discourse about how we are or are not handling this correctly. In the meantime, the patients keep coming. In the meantime, ventilators have been hard to find. In the meantime, we're doubling up on PPE, using it more times than we were trained to do. So my goal here is to teach you how to tap, to acknowledge your concerns. And if you choose to leave me a message or email me at tapping4nurses@gmail.com down at the bottom to listen. So let's get started and talk about EFT. What is EFT, tapping? Emotional freedom technique, what is it? This is a very gentle technique, very simple, that we can teach to our patients and use with our patients and use with ourselves right now, because that's the focus of what we're doing right now. What it does is tapping takes the intensity off of emotions that we're feeling. So for example, if you're time to go to work and you're afraid to go to work, then tapping can help you to feel a little bit more settled about what you need to do, less fearful. You're still going to be aware of all that you need to be aware of. You're still going to understand exactly what's going on. It's not going to wipe out your memory or your thinking capacities. It is just going to make you feel a little more able to face your day. Tapping can decrease anger. It can decrease feelings of sadness. It can help you feel more hopeful. It can help you feel empowered. Tapping can help to alleviate physical complaints, especially those that arise from stress. And new studies are telling us that tapping also can impact on immunity markers, boosting our immunity, which is something that we need right now. So I'm going to provide you with 2 videos a week and hope that you will tap every day, because that's what it takes to raise your immunity. And I'm going to teach you how to use tapping on your own. And when we get through the other side of this crisis, we will start talking about how to use tapping at the bedside. I want you to know that I'm going to be responsive to your questions. Sorry, I had an itch. You can reach me by leaving a message at the webpage, whether it's Facebook or YouTube, where you found this video, or you can email me at tapping4nurses@gmail.com. And again, my name is Mary, but I'll make sure you have that. So let's begin. What is tapping about? Tapping is about, So let's begin. The first thing I need to tell you is that if you are having a crisis, if you are at the end of your rope and you really need somebody to interact with you, somebody to help you, please call a hotline or speak to someone you trust, someone who can care for you on that level. When you finish, when you feel better, I'll be here. You can come back and tap. But if you are experiencing a crisis at a level where you are feeling extremely affected, please get the help that you need in person and then come back and supplement with the tapping. Second, the tapping format that we're going to use today and for many of our videos will require you to touch your face. As nurses, we all know that we need to wash our hands before we touch our face or after touching anything that is not clean. Even when we take off our gloves, we wash our hands. So please wash your hands before you go forward. You can pause this video and come back. I'll still be here. Just wash your hands and then come back and we'll start. So, time to start tapping. Tapping has a few steps. It's not too bad. It has a few steps. And the first step is to identify the problem. Today, let's tap on feeling overwhelmed. Now, the thing about identifying our topic is you need to understand or you need to acknowledge how this topic is interfacing with your own feelings. If you're feeling overwhelmed physically, then that's where you're going to focus. If you're feeling overwhelmed because you're working too much, then that's where you're going to focus. If you're feeling overwhelmed because you are ill, then that's where you're going to focus. You can keep it generic, especially for today, because today is all about learning how to tap. But we're going to talk in future videos about how to be very specific, because tapping is more powerful when we're specific. So we've identified our topic. I'd like you to think about feeling overwhelmed and think about how it feels for you. And then take a scale from 0 to 10, with 0 meaning I am not overwhelmed at all, I am perfectly happy, and 10 meaning I am overwhelmed to the point where I don't know what I'm going to do. And rate it. We do this with pain scales all the time, so you know how to do this, but write your number down. Now usually you want a 5 or above. But for today, we're training in how to tap. So if you're not feeling very overwhelmed and you have a 3 or a 4, it's okay. Just write it down anyway. So this is called our SUD score, subjective units of distress. So you can write down your SUD score somewhere. We're going to look at it in a few minutes. We're going to put our problem of being overwhelmed into terms that our mind is going to understand. And we're also going to do something called elimination of psychological reversal. I think of psychological reversal as the yes buts. So I want to lose weight, but it doesn't work for me. Where you identify your problem, but your brain gets in the way, your mind gets in the way and says, yeah, but it's not going to work. This is a common thing with tapping. We think, well, yeah, it's a good thing, but it doesn't work for me. And so psychological reversal, which includes tapping on what's called the karate chop point, is something that we always begin with. Or we usually begin with. I guess I'd better say that. So our statement for psychological reversal is going to be, even though I am feeling overwhelmed, I accept it and I am okay. And we're going to say that 3 times before we start the actual tapping. So when we say that, you're going to tap continuously on this point. Now before we go forward with the actual tapping, we're going to go through the points. The first point, the first tapping point, is on the edge of your eyebrow. With your finger, you're going to feel the end of the hair on your eyebrow and your brow bone. In your face, you're going to feel your finger hitting on the brow bone, and if you really push on that spot, it hurts. You're going to tap just enough to feel it. You don't have to tap hard. The next spot that you're going to tap on is in the corner of your eye, the outer corner of your eye. It's on the bone. Don't tap on your eye, but it's also not on the temple. And one thing that's very important to understand is for tapping, you need 2 things. You need focus on your issue, which we'll talk about in a minute, but you also need to tap on the right points because we're tapping on the end points of the meridians, which are found in the fascia. So right now we're tapping on the corner of the eye. And you should feel with your finger, you should feel the outer aspect, the outer corner of the orbit of your eye. And on your face, you're going to feel yourself tapping not on your eye and not on your temple, but right on the corner there. The next one is just below your eye. If I'm looking straight ahead, my pupil is going to be right over that tapping point. And you're going to tap on the cheekbone. Not on that under eye area, but on the cheekbone. And this one can be a little bit elusive, so I usually use 2 fingers on that one. You can do right hand, you can do left hand, you can do both hands, you can cross. It does not matter. We're stimulating those points. And we're going to tap 5 to 7 times on each point. And the next spot is that little indentation underneath your nose, about halfway between your nose and your lip, but your finger's going to fit there. I use 1 finger there, or you can use 2, like this. 5 to 7 times. The next spot is under your mouth, but above your chin. It's that horizontal line there. And again, gently, I tend to use 2 fingers. I want to make sure I hit that tapping point. 5 to 7 times. The next spot is 1 inch in from your sternum and 1 inch below your collarbone, your clavicle. And I use either this or this right here. If you push on that spot, it hurts. It's tender. It's called a sore spot. And again, 5 to 7 times. You're going to have to stand up a little bit for the next one because it is under your arm. It is right on the bra line for women, and it is level with the nipple line for men. And again, 5 to 7 times. I use the flat of my hand because it's a big spot. Just tap right there. The last point in clinical EFT, there are other points. There's a long version. We're using clinical EFT, is at the top of your head. When I was a nursing student in an A&P class, we had to learn about the sutures, and we learned that there is a spot right in the center. In infants, there's a soft spot there called the Bregbo. That's where we're going to tap. Again, I use the flat of my fingers on this area because it's a large area, and I want to make sure that I get the meridian point. Now, when you finish with all of those things, you go right back into the eyebrow point again. Sometimes we tap using 4 or 5 rounds, and sometimes we tap using multiple ones. You can tap in some sessions when we're working on deep issues. We can tap for 45 minutes to an hour. We're not going to do this here. We're going to have 5-minute sessions for the most part, unless we find that we need more. When we do the videos, especially today's video, we'll go through the sequence 3 times, and then we'll do an assessment on being overwhelmed. If you find at the end of the session you need to go on, you just keep going. If you want to rerun the video, then go for it. If you feel that you remember the points, then you can do it on your own. It's important to note that if you miss a point, let's say you go from your eyebrow to under your eye and you never hit the corner of your eye in a round, it's not a point. It's not important. You just keep going. Just try to hit it on the next round. You will still feel better. So let's start with feeling overwhelmed, and we're going to start with our opening statement. And what you're going to do is I'm going to tap and say the opening statement, and I'm going to pause so that you can say it after me. Now, the purpose of this is to maintain focus. The words are not magic. The words are simply a point of focus for you to keep you from thinking about your grocery list or what the kids are doing or what somebody said to you. You're going to focus on the issue that you're tapping on. And by verbalizing and thinking about the focus, we have covered our bases and we can focus better. The better your focus on your issue, the better the chance of good results with the tapping and the quicker. So we're going to start with the problem statement, and then we'll go right into the tapping for 3 rounds. Then we will stop, take a deep breath, and check our SUD score again, and then we'll go from there. So repeat after me. Tapping on your karate chop point. Even though I feel overwhelmed, I deeply and completely care about myself. I guess I just changed it. Even though I feel overwhelmed, I am okay. Even though I feel overwhelmed, I acknowledge that and I feel okay. Now we're going to start on the eyebrow point. I am overwhelmed. Thinking about how you're overwhelmed now. I have so many things that I have to do. Under your eye, and I am overwhelmed. Under your nose, I have too much to do. On your chin, I am overwhelmed. On your chest area, that spot, I am overwhelmed. Underneath your arm, I am overwhelmed. And you don't have to stand up like that. I just want you to see. On top of your head, I am overwhelmed. This is the end of round 1. Round 2. Repeating, I am overwhelmed. Thinking about how you are overwhelmed, how you feel. I am overwhelmed. Think about how it affects you as you say those words. I am feeling overwhelmed now. Under your nose, I am overwhelmed. On your chin, above your chin, I feel overwhelmed. Thinking about how you feel overwhelmed. On the chest area, I am overwhelmed. Under your arm, I am really overwhelmed. 5 to 7 times each spot. Top of your head, I am extremely overwhelmed. And I've lost count. This is the last one for now. I'm overwhelmed. I think that was 3, but 4 won't hurt. I am overwhelmed. Thinking about how you're overwhelmed now. I feel overwhelmed. I feel overwhelmed. And at this point, you might be beginning to feel a little less overwhelmed, but keep going. I feel overwhelmed. On your chest area, I am overwhelmed. Under your arm, I feel overwhelmed. Thinking about how, last point, I am overwhelmed. Stop tapping, take a deep breath, and think about being overwhelmed, and give it a number, and we'll interpret your numbers. Write it down, and look at your 2 numbers. Now, if your number has gone down, you are making progress towards feeling less overwhelmed. Your SUD score, a measure of how overwhelmed you are, is lower, and that's good. If you are down to a 2, then it's likely that your mind will just keep working on this and you will feel a little bit better. If you are between a 5 and a 2 and you want to do it again, go ahead. Keep going. See if you can get it down to a 2. If you are above a 5 but coming down, again, you're making progress and you can try again. Maybe you want to tap for 5 rounds and then check your score. And you might want to say, I am still overwhelmed in your tapping statement. So even though I am still overwhelmed, I'm okay. Even though I am still overwhelmed, I'm doing okay, I'm fine. Even though I am still overwhelmed, I'm okay, I'll be fine. I am still overwhelmed. I still feel overwhelmed. I'll finish this round. I still feel overwhelmed. It's a little better, but I still feel overwhelmed. Still feeling overwhelmed. Thinking about how you feel now. Still feeling overwhelmed. Under your arm. Overwhelmed. Just still. Some went away. Still overwhelmed. However you want to say it. I am still overwhelmed. And do as many rounds as you want to do. When you finish with the rounds, take a deep breath and do your SUD score again and see which direction it's going. Now, if your SUD score went up, that's not a problem at all. It just means that things are shifting around in there, and you want to do the still overwhelmed thing again. You might want to change it a little bit. You might want to be more specific. Specifics of a larger problem are called aspects, and maybe your aspect needs to be, I'm overwhelmed about work, or I'm overwhelmed because I'm tired. So if your numbers are going up, you might want to be more specific and go through the tapping again. So this was our tapping exercise for today, but I want you to walk away with something good. And I want to teach you a little bit about how to use tapping on the fly. All right. Sometimes we have to spill the beans. We have to talk about something. We have to tell about our day, or we're angry and we have to talk about it. You can use tapping to help you to resolve or to lessen your experience of that emotion without going through this whole formal thing. So let's pretend that I am having bad dreams at night and I want them to stop. And I'm talking to someone about this distress that I'm feeling. Now, you can talk to yourself in the mirror. You can talk to yourself. Just sit and just rant and rave and put emotion into it. You can talk to a family member. Just tap while you do. A little disclaimer, it takes a little bit to not feel silly doing this in front of people that you care about, but it's okay. Once they see that it helps, they won't mind at all. You can also tap at me. You can imagine that you're talking to me. And just tell your story. So, I had a horrible dream last night. I'm not, and you don't even have to do this. I had a horrible dream last night. I couldn't get back to sleep. I had to get up very early. All I did was lay there and toss and turn, and I'm so angry about that. I'm so tired. I did a crappy job at work because I am so tired, and I'm so angry because I'm not sleeping at night. And this is the third night in a row. This is my second round of tapping now. I've done this for 3 nights in a row, and something must be bothering me, but I don't know what it is. And I can't sleep, and I'm getting cranky, and I'm getting tired under the arm, and I don't know what to do about it. I am so tired because I'm not sleeping at night. When you're finished telling your story, you might want to tap through the rest of the round. Take a deep breath and see what happens. See if you feel better. And if you can get in a SUD score before that, that's great. Compare the results. So I will be back in a couple of days with another video. I'm going to post 2 videos a week. Some topics that I'm thinking about are feeling stressed, feeling confined by PPE, how it's tight, how it's uncomfortable, it's hard to breathe. We'll talk about that. The fear of getting sick with coronavirus, the fear of bringing it home to your family, anger over not having the PPE, distress over using PPE to extend it in ways that we were not taught in nursing school we should do. If you have other topics, please feel free to email me or leave a comment. I'm happy to create videos based on your needs. So thank you again for coming. And we'll do a troubleshooting video in about a week, just in case it's not quite working. But thank you for coming, and please come back. I want to give you a quiet space where you can do some self-care. Bye.